Dental implants are a great solution for missing teeth, but there are scenarios in which things can go wrong. Just like signs of failing teeth, including redness or pain, implants have those similar red flags. Signs of failing implants include looseness, pain on chewing, swelling in the area, foul drain, or redness to the gums and thread exposure. When patients come into our office with evidence of a failing implant, whether placed by us or by other restorative dentists, there are things that we do to ensure that planning the next implant avoids those same problems. So those include a complete clinical exam, taking three-dimensional imaging to see where the failure is, and facilitate treatment planning for that next implant. So in situations where you have a failing implant, there's one of two ways that it can go. Either way, the implant has to be removed. Whether or not another implant can be placed at the time of removal, or if a bone graft has to be placed and an implant has to be placed in the future, is to be determined by preoperative imaging and at the time of the actual surgery itself. If you are in a scenario in which the implant has to be removed and the site has to be grafted before a new implant is placed, generally we wait about 3 months before the next implant is planned. And after that implant goes in, we generally have to wait another 3 months before the implant itself can be loaded for complete healing. When your implant has completely healed and your dentist has loaded it with a crown, you should continue to see your dentist at every 3, 4, or 6 month interval, depending on what your gum health is. Brush that implant like it is a tooth. Continue to floss that implant like it is a tooth. And if there are any problems with your implant, do not hesitate to come back. It is an investment and we want to protect that investment.